you. How about now?
I don't
Oh
think.
gosh,
There you are.
there I am. I'm little bitty.
Perfect. Well, we'll give it just a minute and let people hop on.
Okay. You sent me a few questions this morning. Don't worry about it. I forgot it. Are you still there?
Yeah, sorry.
You sent me a few questions this morning and I can't find them for whatever reason.
I can
Let me
ask
see.
them for you when we get to the questions.
Yeah, one was about pink eye. Oh, here it is. Yeah, how do you identify pink eye? Best method for deworming? What specific minerals? Those aren't necessarily. I guess the pink eye we'll cover that when we're going through systems. So, be frozen.
No, I'm just muted. We'll give
You're
it
muting. Okay.
We'll give it one more minute and then we'll go ahead and get started for those of you who've jumped on early.
Right. That's perfect.
Well, we'll go ahead and get started this afternoon. Thank you all for joining us for Ranching 101. We are excited today to be joined by Dr. Womack, and a few announcements before we get started. If you plan to join us in June, we'll be sitting down with the Government Relations Executive Director, Melissa Hamilton, and talking about what's been happening in the Texas session that's currently going on. So we hope you can tune into that. And then if you have not registered to join us in Marfa, June 8th through 9th, registration is open for our summer meeting. And we would like to thank Lone Star Ag Credit for their sponsorship of Ranching 101. They sponsor each month's webinar and we could not do it without them. And so with that being said, I'm going to pass it over to Dr. Womack and I'm going to share his slides. But if you have any questions throughout the time, feel free to use the Q&A box and we will get those answered for you. So Dr. Womack.
Okay, you got me?
We got you. We're ready to go. I'm going to hit play on your slides.
And you'll advance the slides for me.
Yes.
Is that correct?
Yes.
Okay. Wow. Okay. Well, there's all kinds of arrows and stuff on. There we go. That looks great. Okay. You tell me when you're ready and I'll go.
We're ready.
We're ready. All right. Well, let's go to the first slide because it was really clever. It took me a lot to come up with that. Got a rifle scope, crosshairs there, and we're talking about scoping out sickness. This is Ranching 101, so I don't mean to talk down to anybody, but this is entry level information, and I would like for it to be informative and hopefully helpful. But some of y'all are going to be much more advanced than others, so we're gonna stay with it pretty basic. Okay, so scoping out sickness, that's gonna essentially translate to me telling you how to tell when your cow's sick. I mean, that's kind of the basic premise behind this talk. Got a little bit of a soapbox moment here. I've got a captive audience, so I do take advantage of it. We got to remember that we're dealing with cattle, which are ruminants. The ruminant is nothing less than a miracle. The ruminant takes roughage cellulose and converts it that we cannot use as monogastrics and converts it into an extremely usable and extremely desirable protein source. Don't let the haters hate us. All they're doing is complaining about how bad our cows' farts are for the environment, and they're losing sight of the big picture. The ruminant is a miraculous beast. And I happen to like cows better than any of the other ruminants. So that's my little soapbox. I'm gonna get off of it now, and we'll progress. But it's cows are cool. I like cows, just in case you couldn't tell. Let's start. Okay. Let's go to the sickness slide. So pretty basic. What's sickness? If you look up a definition of sickness, it says the state of being ill. So, what's a cow? What's a sick cow? What's a sick cow look like? That's pretty subjective, but we need to know, I guess, before we decide if a cow's sick, we need to know what's normal. And again, normal is pretty subjective. If you look in the Merck manual and you look up normal vital signs for a cow, temperature 101 Fahrenheit, heart rate 60 to 70 beats per minute, respirations 30 beats per minute. What affects that? Well, lots of things. Ambient temperature. Is it 104 outside? Well, you would expect her body temperature to be higher than that. You'd expect her heart rate to be up. She's trying to cool off. You expect her respiration rate to be high. If it's 4 degrees outside, again, it's probably not going to be 101. Probably going to be a little bit cooler. So normal is as important to know as abnormal. So let's go to the next slide. I had a really cool little series of pictures of cows in different environmental situations. Don't know that it will really translate through. I don't know if it came through, but I mean, nice, lush green calves look pretty normal to me. You put those same calves, you put them in a drought situation. Are they going to be doing as good? Well, probably not. If it's 110 outside, there's no shade right there. They're going to get in trouble. Yeah, they'll be abnormal. Again, normal is very subjective in it, and it is affected by a whole lot of different external factors. Tyler, I don't know. Click advance and see if that advances to those slides. I don't know if it will or not. Because on my screen, the cows are standing in a snowstorm. Well, there's dry, same calves, same pens, different year, different conditions.
Yes.
Clicker again. See what I keep clicking. I'm not real PowerPoint savvy, and I might have procrastinated and done this at the last minute. Keep clicking, see what it gives. If anything happens, great. If nothing, let's go to that next slide. Oh, there you go. She's pretty happy. Different conditions, different environmental conditions, but it was green. Again, different environmental conditions. They're rolling fat. They look pretty normal to me, but that pasture's pretty rough. Try one more. Once we get to the snowstorm cows, you can progress to the next. Okay, that's fine. Let's get back to this. Let's get back to these factors that affect animal health in general. Factors external factors that affect quote unquote normal. Okay. This is a slide I borrowed from Dr. Carroll at the USDA facility in Lubbock. Pretty darn insightful and well put together slide, I think. If you look at it, we got natural variations that affect animal health. There's differences in different types of breeds. You know, you've got Bremer influenced cattle down on the coast that do better down there. You got English, European influenced cattle that do better out here in the West. You got some Corrientes that do, you know, they've got their own little niche. You got some crossbred cattle that have their own little niche. So there's natural variations in the breed effects. Sexual dimorphism, a bull versus a cow, the steer versus a heifer calf. Is there differences in those individuals that affect their animal, their overall well-being? Yeah. Well, a bull's not going to be hung up calving ever. A cow's not ever going to have a broken penis or infected testicles. So, you know, that may sound kind of silly and basic, but there are differences in those effects on the animal's overall health. The animal's temperament, one that's mad and on the hook all the time, is she going to be as healthy as one that's gentle and docile and not stressed by people being in her flight zone? You know, there's variation. All those have effects on the overall health. We go to over on the right side, we got management influences, vaccine protocols, you know, certainly vaccinating versus non-vaccinated cattle, that has a big effect on their health. When they're exposed to pathogens that we normally vaccinate for, do they get sicker than they would if they were vaccinated? Well, sure. Weaning strategies. Do we wean them onto the trailer and ship them to the sale barn, and then the next owner down the line has to deal with the effects on that animal's immune system and overall immune system strength? Well, sure. Dietary effects. Are they droughted out? Have they been malnourished? You know, you take those animals that have been malnourished, and it does affect their overall health, obviously. Environmental, we already kind of talked about that. You know, 110 to 10 in West Texas, that's certainly a possibility. And those environmental stresses have an overall effect or have an individual effect on the overall health of the animal. And then something people don't think about, but prenatal influences. Were the dams, were the moms stressed during pregnancy? Was nutrition adequate? Were they vaccinated adequately? Was it a drought? Those things affect that individual's overall health. Many times there's a term called fetal programming, and it's well proven that proper fetal programming, proper nutrition, proper mineral supplementation, proper overall health of the dam has a very, very long-term effect on the overall health of that calf when it's born for many years down the line. If they're poorly developed in utero, then they have more health problems as an adult later on. And pathogen exposure, obviously, if your pregnant cows are exposed to a pathogen, virus or bacteria that causes abortion, well, that's darn sure going to have an effect on that calf's overall health. It's going to die. So this is a neat slide. I always love looking at this slide and coming back to it, because Dr. Carroll was really insightful when he put this thing together, and absolutely correct. So So again, me being charged with scoping out sickness, how to tell you, how to tell you when your cattle are sick. The next slide, I stole these from I put the next two slides together for actually a group of cowboys working for a big ranch that I do work for. We were having a good year, normally a cow-calf operation, and we had an unusually good year and had excessive forage, and we branched out into the stocker operation. We bought a bunch of stocker calves, and the cow-calf cowboys were having a little hard time. So we put this together. It seems kind of silly and corny, but it helped us. We ended up putting these next two slides up. We tacked them up in the medicine shack by the chute, but we titled it "Clinical Evaluation of Livestock." We had two steps. It seems kind of rudimentary, but evaluate the whole group. Think of a pen rider in a feedlot situation. What do? They look at that whole pen of cattle, right? And ask yourself, when you're looking at them, do any of the individuals stand out from the rest? Well, if you say no, you got two questions to answer there. Are they all normal, or are they all sick? Well, that goes back to what's normal, if they're all got their ears down, if they all got hollowed out eyes and sunken flanks, are they all sick? If they're all sick, we need to evaluate the whole group, right? So if we go back up, we look, any of the individuals stand out from the rest, and we say, yes. Is that individual sick, or is that individual normal and all the rest of them are sick? Well, again, we got to go back and that subjective normal versus abnormal. If the individual's sick, well, we pull that calf out and we look at it and evaluate it. If it's healthy and it's normal and all the rest of them are sick, well, we're going to have to go through a bunch of cattle, take a look at them. I had these guys assign a score. We use this in research projects too. When we're evaluating at the university, or even vaccine companies that are doing clinical trials on the efficacy or effectiveness of their vaccines. When the evaluators are asked to evaluate a group of animals, they assign clinical scores. Clinical score 0 would be normal, and 1 means you looked at it twice. If it caught your eye twice, you looked at it, maybe we need to reevaluate that. Score 2, they're obviously sick. We need to treat them, right? Score 3, they're bad. We needed to probably treat them yesterday. We looked at them yesterday. They were 1. Maybe we looked at them, and then today they're a 3. Well, they need to be treated. Score 4, we're pretty much on the way out. Score 5 is pretty easy to tell. Dead's pretty dead. There's not a lot of wiggle room around that one. Tyler, let's go to the next slide. This was the next slide was the companion slide to that first one, and it gave the guys and gals too. There's some gals involved. It gave them a kind of a breakdown of things to look at from almost a systematic approach, looking at different systems that are affected. Number 1 area, you look at general appearance. They're light, bright, and alert, normal, clear eyes, no drainage, full eyes, nose looks normal. They're easy breathing. They're not thumping. They got good fill. Their abdomen, they're not hollowed out in the flanks. They look good. They pee, urinate normally. No dragging of the limbs. Look at their musculoskeletal system. No swelling. No obvious swollen joints. They're moving easy. Make them move around. Make them let you look at them and evaluate them. And then we go through the areas to evaluate, and score them. Well, again, we go all the way over to the right-hand side, dead's dead. That's a pretty easy score. 1 to 4, there's a little bit of wiggle room in there, and there's some cowmanship and some husbandry that needs to take place. You need to know your animals. You need to spend a little bit of time just watching them. Cow-calf producers, I find them, they like their cows. They look at them. They spend a little time looking at them. And you get to know your cattle a lot of times. I do. So you go through there and you score at them. We had a question that was presented earlier about pink eye. So we go down to the third category, eyes. Well, pink eye, in my experience, pink eye typically is both eyes. They're going to be the sclera, the white parts of the eye are going to be pink. They're going to be red. They're going to have drainage. And again, true pink eye is usually both eyes. It's usually contagious. So usually more than one individual is going to have pink eye. If it's just one eye, it's usually some kind of traumatic event. Okay, something that scratched it, it got something poked in it. Another horned cow stuck a horn in its eye, fell down going to the chute and whacked its eye, something like that. But true pink eye is usually going to be both eyes, usually going to be contagious and be more than one individual affected. And again, we're going through these things systemically, looking at them. We get over to the genitourinary tract. Well, obviously, if we have a cow that's got a prolapse or hung up, calving, that's going to be over in that 3 and 4 area there. We'll score 3 or 4. We need to do something. We need to intervene. If you find her out in the pasture and she was hung up, calving, and died, well, that's pretty easy to score that animal. She's a 5. Anyway, this seems a little bit silly to put it this way, but it worked surprisingly well for us. I think we ended up with 12 loads of calves that summer, and we treated a bunch based on these two charts and did pretty good. So, all right, let's go on to the next slide. And there we go. Areas of focus to prevent sickness. We had a couple of questions earlier presented before the talk. One was about minerals in lactating or pregnant cows. Can't remember. Obviously, nutrition's our primary goal, or primary area to focus on when we're trying to prevent sickness. I think the question was, sure enough, I think it was about minerals in lactating cows. Well, obviously, what's milk made out of? Calcium and phosphorus. So obviously a calcium phosphorus mineral supplement's paramount to a pregnant and lactating cow. The trace minerals packs in range minerals are very important too. The trace minerals are essential for proper lactation and uterine health, ovulation, skin health, overall well-being, all the enzyme systems that reduce inflammation and oxidation in the entire body are fueled by trace minerals. The milk production, the macro minerals, calcium and phosphorus, obviously sodium and chloride salt's important. So those are biggies for nutrition, and specifically to that question, the minerals for lactating cattle. So that's obviously nutrition. Go back up to Dr. Carroll's slide with the black calf and all the different areas that affect the animal health. Nutrition's a big component. Immunity, we think, how do you get proper immunity? Well, you got to vaccinate them. Well, that's right, but we also have there's genetic immunity. Some breeds of cattle are more immune to certain types of diseases. Bremer cattle, crossbred cattle, European cattle, again, they all have some differences in their genetic makeup that can affect their immunity to diseases. People select for genetic immunity, and it is a real selection tool that we can use that helps with the overall immunity. And then geographic, that sounds weird, but there's certain diseases that cause sickness, or certain pathogens that cause sickness in cattle that are distributed geographically. Anthrax is one. Anthrax is pretty common and pretty widespread in my part of the state, but you go east of here and it's not. So there's a geographic component to immunity that people don't think about. You go to East Texas and there's certain pathogens down there that are in the environment. Blue-green algae. We very rarely have blue-green algae out in our part of the world because the water doesn't stand around long enough to develop algae. But a lot of these surface tanks in East Texas, blue-green algae can be certainly a deadly disease of cattle. Ticks, tick-borne diseases, anaplasmosis. There are diseases, tick fever down on the quarantine zone. Those are all what I would say are classified as geographic effects on immunity. And then go down to parasite control, internal and external. There was a question posed about the best way to deworm cows. Well, the best way to deworm a cow is to deworm them when they need it. And for your environment, it depends. If you're in East Texas and you got flukes, well, you better be using a dewormer that is effective against flukes. In our part of the world, wide open spaces, cattle dispersed pretty widely, not a lot of moisture in the grass. We don't have a whole lot of transmission of gastrointestinal parasites in our part of the world. You go further east where there are higher rainfall amounts, higher stocking densities, more moisture in the pastures. Those animals need to be dewormed, obviously, in a different strategy. And talking to your local veterinarian about what is in your geographic area would be my advice. There's not a one size fits all type of program for parasite control or deworming. External parasites, don't forget about them. We have a lot of ticks and lice in our part of the world. A lot of flies when there's enough moisture. When it's real dry, the flies aren't very bad. External parasites, don't forget about them. They stress the animals, and they do. Stress is a difficult term to define, but think about it. If you got 2,700 horn flies buzzing around your back and your head and your neck 24/7, that's stressful. It's proven that it can cause weight loss in cattle just from the irritation associated with it. These are areas, again, that I think it's important for a producer to contact their local veterinarian to get some input on what's important and what's common in your area. And again, what affects my producers in my part of the world and what affects producers, in the Trinity River bottom are completely different. Okay. There are some similarities, but there's a lot of dissimilarities that are noteworthy. That leads me to the next slide. Thanks, Tyler. The veterinary client-patient relationship. Going forward, this is going to be more important. I know everybody's heard about it. Come June 11th, over-the-counter sales of antibiotics it's going to go away. All those over-the-counter antibiotics that you get at your local feed store are going to be removed. And you're going to have veterinary oversight to get prescriptions for those antibiotics. For those of y'all that already have a veterinarian that performs procedures on your farm, coming out and preg checking your cattle, brucellosis vaccinating your heifers, trick testing, semen checking your bulls, and it's already well established, it's not going to change a thing. It doesn't make a bit of difference. You've already got that veterinary client patient relationship, and it's not going to change anything. Those of you that are used to going to the feed store and buying some LA200 or some penicillin and giving it to a calf when it's sick, well, you're going to have, and you don't have a veterinarian involved, you're going to have a veterinarian involved. That means you're going to have to either load those calves up and take them to the veterinarian for evaluation. If you have any of them die from pneumonias, from diseases, getting the veterinarian out and having them do a postmortem exam, taking cultures, submitting cultures for identification of the pathogens that are causing disease is important. There was a question about, best way to treat a chronic cough. Well, the best way to treat a chronic cough is to know what caused it. And, without doing a culture and sensitivity and identifying what organism is causing the cough, it's very difficult for me to tell you, if not impossible for me to tell you how to treat it. So that's important. This is a bunch of lawyer driven, no offense to any lawyers out there that are watching, but this is a lawyer driven derived document here. This is part of our Practice Act. And I mean, y'all can read it as good as I can, but the long and the short, it means we have to know who you are. We need to know about your operation. We need to have done something with your cattle. It says somewhere in here, it says about a timely manner. Section number 2, make a medically appropriate and timely visits to the premise on which the animal is kept. Timely is very, very subjective. The legal counsel for the State Board of Veterinary Medical Examiners and the Texas Veterinary Medical Association tells me that is a 12-month period. If I haven't seen or been on your property, your premise, your operation, or seen representative animals from it in 12 months, I'd no longer have a valid VCPR. That's not written in there, but that's what the lawyers tell me that is defensible if it comes to it. So let's go to that. Let's go to that next slide, Tyler. Like I alluded to before, you with me? There we go. The cattle production cycle. Again, I pilfered this slide from one of my multi-man talks, but it does kind of it breaks it down and gives us some ideas of when there is some portions of the cattle production cycle where a veterinarian could be involved. Obviously, if you got a cow hung up, birth, we're going to see them right there. The weaning of the calves, are you going to give them? Are you going to give them, the females, brucellosis vaccine? Are you keeping replacements? Obviously you got to have a veterinarian involved there to vaccinate them for brucellosis. There was a question about a vaccine protocol. Well, this is a time when you get your veterinarian involved. Hey, we're going to wean calves. We're going to buy some stockers. What's hot and what's happening this year? What are you seeing in other herds? There's year to year variation in the pathogens that are causing sickness. And again, how are you going to know? Could you put a program together for me? Yeah, absolutely. We do that all the time. But without knowledge of what your capabilities are, it's difficult for us to do that. And again, it's not a one size fits all. I can't just throw you out of a protocol and say, this is what you do. So, again, back to the production cycle, the cows, again, a lot of people will have us come out and preg check. We'll ultrasound a lot of cattle every year. I bet on a year to year basis, I'll probably preg check 4,000 or 5,000 cows. So, we're busy doing it. You go to the bull again. I think if you're not semen checking your bulls before you put them out, I think you're asking for trouble. And I always test my bulls, even my own bulls, before breeding. So, again, that's just a little depiction of the times when a veterinarian would be involved and could be involved in your herd health. Let's go to that next slide. I think it's redundant, but I remember right. Yeah. Again, here we go. Again, I put together a lot of these slides from other talks, and this was just a slide depicting when people need me. When do you call a veterinarian? Why am I involved? Disease identification, like we were talking about. You got pneumonia calves. You got calves that are dying from some kind of disease. We need to know what it is. A necropsy on a dead animal may be very valuable in preventing ongoing death loss. And some of those dead animals are extremely useful at helping us determine what else is going on. So, and again, that the evaluation of the sick animals allows us to tailor treatments and preventions for your animals. Vaccination recommendations, parasite control, nutrition. I'm not a nutritionist, but again, go back to that Dr. Carroll's slide about the different things that affect the overall health of the animal, and nutrition of the individual animal, nutrition of the dam while she's pregnant with that calf. They're very, very important and paramount in establishing a good long-term healthy animal. There's regulatory issues and regulatory procedures that veterinary only driven. And again, brucellosis work, trick testing, tuberculosis testing, prescription feeds require essentially a prescription. The veterinarian has to write to the feed company for you to buy medicated feeds, antibiotic containing feeds. That's called a veterinary feed directive, or VFD. If you're shipping cattle out of state, most states are going to require you to have a certificate of inspection, or a quote unquote health paper. Again, veterinarian has to sign off on that. And prescription medications. There's many of my producers already come to me for prescription medications, and the two that are over the counter, it's just not going to change anything. They're just going to have to get a prescription for it. Well, again, it's not a big deal for those producers that already have a well-established VFD. They're already buying prescription medications either for treatment of infections or inflammation or whatever. They're already getting them from me. And it's not going to be a big stretch. Those of you that don't, you need to establish a rapport. You need to establish a relationship with a veterinarian. So, and then reproduction, like we talked about, the preg checking cows, semen check-ins, and trick testing bulls, vaccinating heifers for brucellosis. So, excuse me. The next slide again just shows, I just threw this in there just for demonstration purposes. This just is my production calendar. This is what I do for my own herd. It's worked. It works well for us. We have a cow-calf operation. My son and wife and I do. We have several different lease places. We're bringing cattle. They're all our cattle. We try to put the bulls out at the same time everywhere. We try to pick them up at the same time everywhere. We try to work our calves within at least 10 days, 2 weeks of the same time. And then we wean them essentially all 10 days, 2 weeks is just the logistics of getting them gathered and moved to a central location. We wean them all at my son's house, and then we market them, no plug, but we market them through Superior, typically sell 2 loads a year. This is our program, and this is what works for us. Not going to dwell on it. Again, just threw that out there as an example of what organisms are important for our part of the world and what steps we take to try and prevent. This does not go into treatment of any sick animals. That would take, we could talk about treating different diseases and different pathogens. It would take weeks to cover all that, and we don't have that time. This is basic. This is Ranching 101, and this is scoping out disease. So as the name applies, I'm sorry for any of y'all that weren't ready for this, but it is Ranching 101, so there's going to be an examination. And it's I don't want anybody to get pressured up or sweat about it or have any test anxiety. We'll walk you through it, but we're gonna have to have an exam. So Tyler, if you're ready, question number 1, let's do it. Let's get to it. We're gonna use the tools that y'all have learned today. All right. First question we're going to ask is what? Is that animal normal or not? Does she stand out from the rest? I can't read the tag, but I think that's number 23. Is she standing out from the rest? Well, everybody else got their head down and eating. So the answer to that question is what? Yes, she stands out from the rest. We're gonna give her a clinical score of 0 though. She's normal. Took a step back. I was taking pictures. I took a step back. She went back to eating with the rest of them. So she's a good old 0. Normal. Nothing going on with these cattle, right? Looks great. Everybody get that one right? I hope everybody got that one right. That one's pretty easy. Okay. Question number 2. And this is self-graded. Okay. We're not gonna make you submit your answers, but self-grading honor system. So let's go to the next one. Normal or not? Well, let me see if I can get to it. Okay. Yeah, she kind of stands out from the rest. She got some stuff on her nose. It's kind of weird. Let's look at her a little bit more. Walked by her and saw all this stuff on her nose. So what did I do? I turned around and I looked at her again. So I looked at her twice. So I'm going to score her as 1. Closer examination. These were fresh cattle off the truck. Had a feed bunk right there. She went and stuck her nose in the feed bunk. She had some clear nasal discharge from the trailer ride, which you kind of expect. Little bit of drainage from the eyes, but she only picked her head up to quit eating for a minute. So really, I scored her a 1 only because I did. I'm walking by, I'm looking, I stopped, went back and looked at her again. So she's a 1, but we don't need to do anything about her. Okay, makes sense. Hope so. Hope everybody's still awake. It's lunch hour, I know. Okay, question number 3. Normal or not? What would we evaluate about her? Her overall demeanor, she got her head down, right? Looks kind of yucky. What do you notice about her musculoskeletal system? Besides her head position, she's got a ginormous abscess on her, right? If you look a little closer, if you can, it's actually draining. So yeah, normal or not, stands out from the rest. Yes, she does stand out from the rest. Rest of them coming to feed. She's the last one. She's moping along. Looks funny. We need to evaluate her. She's gonna get a score of 2. She had to go to the pens. We treated her. We opened the abscess, treated her with antibiotics, anti-inflammatories, and I actually used IV sodium iodine on her. This was actually lump jaw. I bought a new bull from up north, brought him in, and I had a year's worth of hell of lump jaw in my cattle. Never had lump jaw before, but we traded a bunch of cattle that summer for lump jaw. She survived, still have her. Did well, but she was sick. She felt bad. So, okay. So we've got a score of 0, a score of 1, a score of 2. Let's go to the next one. Wow. Okay. Normal or not? I hope everybody would say not. Does she stand out from the rest? Well, her entire uterus is hanging out, so I hope she stands out from the rest, right? I guess we would evaluate lots of things on her. She's humped up. Look at her flank. She's empty. So her digestive tract is completely empty. She's gutted. She's got a hump in her back when she walks. She walks with a hump in her back and very slow and very poorly. And her rear end is really, really unstable, primarily because of her genitourinary tract. Her entire genitalia, her entire uterus is hanging out. So I would classify her as a score of 3. That's pretty critical, obviously, I would think. She's going to die if we don't do something. And we did. We treated her. We actually amputated that prolapse. She's a beef animal now, but she felt better immediately, went over and talked to the owner last week, and she was still raising a calf. So she survived treatment. Okay. I see the time's getting away from us, so we're going to speed it up a little bit. Go to the next one. So we got a 0, 1, 2, 3, and go to 4. Hello. There you go. All right. Wow. Yeah, I got it. So, wow. Normal or not, I hope everybody says not. Stand out from the rest. My gosh, I really hope she's standing out from the rest. Clinical score, she's a 4. She's what we would call moribund, or she's a fixing to die. Everybody can see that. This is a file. This is not one of my clients' cows, thank God. But the outcome from that animal couldn't go to slaughter. You wouldn't have any choice really but to euthanize that animal. She's just a bag of bones, and that's a horrible situation. Hope nobody has to see cattle that look like that. Okay, let's go to so we got 0, 1, 2, 3, 4, and then obviously the last slide. Go to that one. Pretty obviously how to score this one, right? She's on the side of the road, 4 feet up. That's an easy score. That's a score of 5. Outcome is drag her off the road so nobody else hits her, right? If there's an insurance company involved, the necropsy, that's something you'd have to call me. I'd have to prove she was hit by a truck, and then that goes to the insurance companies. So again, it's kind of down and dirty. I see the time. I'm trying to be cognizant. I would go to the next slide real quick, Tyler, and try to sum it up here. And maybe. And remember, we don't always live in an ideal world. That calf is not living in an ideal world. Everybody's in agreement for that. And go to the last one. Next to last one. And remember, if you're swimming in circles, you need to ask for help. This calf needed some help. He had been weaned for a grand total of about 5 minutes. And one wall of the pen where we had him in was that rock tank. And he was in it in a minute. And they can swim for a long time. And if you rope them, you can drag them around. It's easy to drag them around because if their feet can't touch the ground, they can't pull against you. So we roped him, drug him to the side, took the tractor, and pulled him out. And just to sum it all up, now go to that last one. Go to that last one. I have to show that slide every time. Every time. The last one is just to encourage you to pay attention to what's going on. Read that sign. My wife and I were in Albuquerque, and I made her drive around the block so I could take a picture of that. I know they do different. I know they do things differently in New Mexico, but again, you got to pay attention. That's all I got. I know it was fast and furious. I tried to address the questions that were posted to me before, and we've got a little time if anybody's got any burning questions for me.
Yeah, if anybody has any questions, you're welcome to send them in the Q&A box below at the bottom of your screen, and we will do our best to get those answered for you.
I hope that fit the bill for the topic that you presented to me. Not trying to talk down to anybody, not trying to be silly about it, but just get some basic information. The people lose sight of that. Back up a minute, let's look at the situation. Sometimes, for instance, I had it's not cows, but I had a lady bring me on the first cold day of the fall. I had a lady bring me a goat because it was swollen. And I said, well, where's it swollen? And she said, all over. And the little goat, his hair was standing up. It was cold. It was the first norther blew in, and his hair was standing up, and it looked different to the lady. And again, there wasn't anything wrong with him other than he was cold. But she was very concerned that the animal had total body swelling. So, pay attention, look at things. And new cattle owners, new livestock people, it takes a little time. I've been in practice for 31 years, but I've been around livestock all my life. So it's hard to impart 58 years of wisdom in an hour.
Well, we've got a couple questions. The first one is, what should I
Okay.
look for in a vet?
Well, obviously, if you look at me, they got to be suave, debonair, good looking, and modest. Okay, sorry, I couldn't help with that. I couldn't help that one. You need somebody that is does mixed practice. If you can't find somebody that does a mixed practice, has a mixed practice, there's lots of veterinarians running around out there in small animal only practice that come from ag backgrounds, and they can, we're all trained the same. They can still help you out. They may not have facilities, but get to know them. There's people in your community, there's small animal veterinarians, you get to talking to them and you find out that a lot of them came from an ag background. I think mixed practitioners or large animal practitioners, food animal practitioners, honestly, I own livestock myself. I think it gives me credibility with my livestock producers. So I think that's something important to look for. I wouldn't trust a vet with my dog or cat that didn't own a dog or cat. So I think, and there's a bunch of small animal veterinarians that own livestock, a bunch of them. So that's what I would look for. Somebody that owns livestock or at least came from an ag background.
What is the name of your vet clinic and how far do you drive for service?
It's the Los Caballos Veterinary Clinic. And I hate to tell you how far I drive for service. I do have a yard in Dumas that I call on. It's 350 miles from here. My general practice area, I went to Rankin yesterday for a rabies clinic. It's 97 miles. I guess I got a client in Nolan County that's about 70 miles, probably 70 to 80 mile circumference from San Angelo. We're crazy busy. And a lot of my large animal livestock producers, they schedule stuff months ahead of time. They know when they're going to be working bulls. They know when they need to turn bulls out. And we get stuff scheduled 2-3 months ahead of time. So.
Well, our last question for you is, what is your opinion of feed-through meds for horn flies?
I use them. How about that? I think it helps a little bit. I use the IGR mineral. I use Hudson Livestock Supplement. I use their tubs with IGR in them. And I do think it helps. It's not going to prevent you from having to treat for flies, either fly tags or topicals. Honestly, during the summer, I feed my cows up against the fence line and I drive behind them in the Ranger and use Ultra Boss, pour on and squirt them when the flies are really bad. That's kind of cheating, but it works. It works for mine. Mine are gentle enough and food motivated enough that I just take the trip hopper and dump it right next to the fence where they're all lined up and drive right behind them.
Well, thank you so much for joining us today. And for everyone who attended, we will get this recording sent out to you in 24 hours. And if you have any questions, you can always reach out to us at education@tscra.org. Thank y'all.